It was another record-breaking year in the United States for overdose deaths. The latest provisional data from the CDC shows more than 100,000 people died in 1 year, ending in October 2021. More than 5,000 of them in New York State.
No more drug war!
At City Hall, advocacy groups pushed for new legislation that they say is evidence-based, claiming these deaths are preventable. They're calling on the state legislature to pass the Safer Consumption Spaces Act.
Essentially, medical spaces where people can bring pre-obtained substances to use under the guidance and supervision of medical staff, and also have access to a range of treatment services to prevent preventable overdose deaths.
Two already exist in New York City, the first in the nation. The bill would bring these safe injection sites across the state. They say these OPCs, or overdose prevention centers, are not shooting galleries.
You can walk into an OPC and get connected to care providers, get connected to all kinds of services in a really welcoming, loving, dignifying environment.
Shantae Owens is a former drug user who says he's been clean for 10 years. A harm reduction center that provided him with clean syringes and treatment resources, he says, is what got him sober.
Before there was a harm reduction syringe exchange program, I found my syringes on the streets of New York City. That's where I end up getting HIV.
The group is also calling on legislators to decriminalize buprenorphine and methadone, synthetic opioid medication used to treat opioid addiction.
It's sometimes difficult to access, and then when people do have access to it, sometimes it can be criminalized. So we're trying to make sure that people that are sharing medicines that keep people alive are not put in jail for that.
The bills have been introduced, and the advocates say they need more co-sponsors for support to make it law. At City Hall, Michelle Ross, Pix 11 News.